Okay, guys.
Carpal tunnel
This is a
syndrome
little
is
bit loud.
characterized by
One
a
second.
tingling numbness or pain in your hand, and sometimes forearm. It develops due to the swelling of a ligament in the wrist, known as the transverse carpal ligament.
Okay, guys.
The swelling of the transverse carpal ligament creates pressure on the median nerve in your
I thought
wrist.
it'd be kind of cool.
This nerve is responsible for supplying feeling and movement to various parts of the hand. Performing repetitive motions with the hand or wrist over a long period is the main cause of carpal tunnel syndrome, and the condition is more commonly seen in women than men. Researchers have also discovered that other medical problems such as alcoholism, arthritis, diabetes, obesity, and infections could also lead to carpal tunnel syndrome. Today we'll be operating on a patient who has been diagnosed with carpal tunnel syndrome after experiencing numbness and weakness in the palm of his hand and thumb. Now let's put on our gloves and get started. The limited open carpal tunnel release surgery is performed using a local anesthetic that numbs the carpal tunnel area of the hand and wrist. If a patient is nervous or uncomfortable, I'll sometimes use a sedative as well. A sedative is a drug given through an IV that places the patient in a dreamlike state. However, our patient today will only receive the local anesthetic. Go ahead and get the operating area numb.
It's kind of the dream state. It's actually not that bad. It's just real, blood. Okay, he's bleeding. Just so you guys know, I hate getting shots. Worst thing in the world to me. Just the sound effect, though. Let's shove one in his face. I'm kidding. Shove one there. Can I put one there? Okay, no, I can't.
With the wrist anesthetized, we can now begin the operation. I've already tied a tourniquet around the patient's upper arm. Can you go ahead and outline where we'll be making our incision?
Yes, I'm gonna draw. I'm gonna write hi. Uh-oh. Boom. I'm gonna write hi on his hand. Hi. Sorry if my game's lagging. And bop. Bop. There we go.
Looks good to me. We'll be making a 3/4 inch incision at the intersection of those lines. Now take the scalpel and make the incision.
I'm not gonna like this. Okay, I can do this. Ooh.
Nice. I couldn't have done it better myself. Now we'll spread the incision wider to expose the transverse carpal ligament. This band of tissue is the cause of the problems. Place the retractors into the incision and spread it open. I think you're a natural at this.
I'm glad I just missed that.
I think you're a natural at this.
Did you guys heard that twice?
With the transverse carpal ligament exposed, I'll need you to slip a carpal tunnel guide into the incision. This is a blunt-tipped instrument with a groove on the upper surface to accommodate a special knife. The carpal tunnel guide is placed down the carpal tunnel and underneath the ligament and is used to protect the underlying nerve and tendons. Go ahead and push the carpal tunnel guide into place. Once
you can see it. That's disgusting. I can go further? Can that?
Once it's in position, you'll advance our special knife down the guide to split the carpal ligament.
Yeah, so
as you push the knife forward, you will feel it cutting through the carpal ligament.
That's disgusting.
Perfect.
No, I didn't do anything.
With the transverse carpal ligament cut, the median nerve is no longer inflamed. Now we can begin to...
Let's do it again. I have to cut it again. Okay, it has to cut it. No, please don't make me watch this. Okay, it wasn't that bad. Yay. Pull it out of his body. That's disgusting. You guys can see that bump too, right? Like I said, sorry. Like I said before, I was rudely interrupted by this guy that's ruining my life. I'm going to be doing one video a day, but today's special. First day of YouTubing, 2 videos. That's disgusting. You guys can see that cut too. Okay, get out of here. My game's lagging really badly. Oh, oops. I meant to do that. I'm trying to get back on it. Okay, perfect. What do we do now? Click.
The median nerve is no longer inflamed. Now we can begin to clean and close the incision.
Okay, thank you.
Go ahead and irrigate the wound. When you're finished, I'll release the tourniquet, allowing blood to flow back into the hand.
What is that?
Great. Now you'll close the wound using non-absorbable sutures.
Oh, dang it. Oh, ew. That's not that bad, though. Okay. No blood. No blood, no worry. My mom and aunt are at the grocery store right now.
With the wound closed, we'll inject additional numbing medicine around the operating site to help relieve some of the immediate pain the patient may feel after surgery.
Well, no, there's immediate pain. Sorry if I'm yelling into my mic. This is disgusting. That sound effect, though, that's disgusting. Doesn't the marker affect that cut? I mean, I'm no doctor, but I think I'm smart enough to know that if you got marker into your cut, you would get an infection.
And lastly, we'll place a small dressing over the wound to absorb any residual blood.
It's disgusting. There wasn't blood the first time we gave them shots. There was no blood at all. Did you guys hear that, right?
We'll immobilize the wrist with a splint and a sling, and after 1 to 3 hours, our patient is sent home to recover. Our patient needs to keep in mind that because of some of the medications we used, he may experience a bit of nausea. He will also be given pain medication to help relieve the discomfort he'll feel in his wrist. Once our patient returns home, he'll be asked to follow specific instructions.
Guys, just so you know, I'm doing ones because I saw a few from Jacksepticeye. I'm weirded out by that picture. That's disgusting. Am I even videoing this? I need to pull this up. Okay, it's been 8 minutes. I bought the full version of Bandicam, so you guys won't have to worry about, there being a time limit to my videos. I can do a 2-hour video if I want. But I don't want to. So I'm doing 2 videos. Not doing that. What's that? Not doing that either. I watched that one. That was disgusting. I also watched that one. Oh, let's go up. Eye surgery. What's that? Laser hair removal? You guys are saying this, right? No, I saw that one. What's that? Sorry if this is kind of being boring, guys. I'm just looking for one. Maybe we should do... You know what? My stepmom actually... I think my stepmom actually had her gallbladder removed. I'll check this out. Yeah, my stepmom had her gallbladder removed. Let's watch this now. I don't even want to know. Let's scrub it. What does that even mean? I'm a little bit disgusted by this, guys. I'm not kidding. This might be a 60-minute video because the first one took 8 minutes. It took around 8 minutes. So disgusting. I wanted to do this. No! If you guys are laughing at me right now, no! You're mean. I'm trying to get this as low as I can. Maybe it'd be a little bit better if I just did that. Well, I should have kind of... You know what? Don't tell me I didn't record any of this. Second, I'm gonna pull up Bandcam. This thing. Got it stuck. Pull it up. Okay. Yay! I recorded this. I was a little bit worried I didn't record again. That's weird. Why do they have to make it that loading? You know, it's a scalpel. It's a scalpel going in someone. No. I would never do this. Ever.
Hello, and welcome to Surgery Squad's virtual laparoscopic cholecystectomy. I'm Dr. Susie, and I'll be guiding you through this procedure today.
Gallbladder removal.
Your gallbladder is basically a place that stores bile generated by your liver. As your body digests fats, your gallbladder pushes bile into the common bile duct, down to your small intestine to help digest them. Gallstones form when the bile hardens into small pieces that block the common bile duct. These stones can consist of calcium, blood, and cholesterol, and they can cause moderate to severe pain, along with nausea and or vomiting. When this happens, it is called a gallbladder attack. Gallbladder removal is the best treatment for gallstones. There are 2 types, open gallbladder surgery and laparoscopic cholecystectomy. Open gallbladder surgery involves one large incision and removal of the gallbladder.
Yeah,
it is performed when the laparoscopic method is not possible, or when complications or too much scarring from previous surgeries are found, or when the patient's blood won't clot well. This type of surgery causes more pain and longer recuperation time.
Is that Slenderman?
A laparoscopic cholecystectomy, however, is the most common and often the best method to remove a gallbladder. It is where the gallbladder is removed through several small cuts in your abdomen. The surgery is safe, and folks who have it normally recover within 1 week.
Yeah.
There are a number of benefits to having laparoscopic cholecystectomy. Among them, you'll be able to eat food without pain in most cases. It eliminates any discomfort in the stomach lining, and in some cases, it relieves your upset stomach. However, if you have your gallbladder removed, you might experience chronic diarrhea, indigestion, trouble digesting, severe liver problems, fatigue, and rare but intense abdominal pain. The patient waiting for us has been suffering from pretty severe gallstone pain, so it is imperative we get his gallbladder out. Let's scrub up and get going. Our patient is already under general anesthesia.
What is that?
Thanks to our nurses and anesthesiologists.
That's his belly button.
We're going to make 4 small incisions. 1 right below the belly button, and 3 others right over the abdomen.
Yeah,
first,
this is when
we'll disinfect the area where we're going to make our first incision.
I called it. That was the... Making his stomach orange. I have to like... Whoa. Let's disinfect this area now. Can't do it. It won't let me. Do I have to like disinfect this whole thing? Just do it for me. I'm lazy. I want to get on with my night. I need to finish this video quick. Because I'm going to get in trouble if I don't take a shower. And I spent like 10 minutes watching YouTube. So if I don't get in the shower and finish by the time my mom and my dad, my aunt get home. Okay, I didn't actually have to do all that.
Now
no!
take your scalpel and make a small incision right below his belly button.
Dang it! No, I'm not doing this. Fine. Okay, that wasn't that bad.
Nice and clean.
Nice and clean.
Where we're going. So we'll first inflate his abdomen with a little carbon dioxide to have some room to work.
That's weird. I bet some of my friends aren't even watching this. This is going to be uploaded kind of late.
Now we'll use this laparoscopic camera to help us see where we're going. We'll watch our monitor as we go.
Yeah, I'm going to upload this on Tuesday morning.
Slow and steady. You're doing a great job.
Those sound effects, no!
I'll take care of the other incisions for our laparoscopic tools.
Okay, thank you.
Now that all of the trocars are in place, can you move the liver out of the way using the clamp so we can get to the gallbladder? Excellent work. We should have plenty of room to work now. Before making any incisions into the gallbladder, we'll need to clamp off the bile duct in 3 locations.
1 location. We're putting hair clips on this gallbladder. This is not very professional. Oh yeah, if you guys want to play
Great. Now use the scissors to sever it.
If you guys want me to play, that's disgusting.
I'll hold the gallbladder in place while you work to cut it from the liver. We'll use an electrocautery device to minimize bleeding.
Okay, if you guys want to see me play more of this, please don't make me.
Fantastic. Looks like
This
you've
is
done
horrible.
this before. One last thing. Let's take our clamp through the cut under the belly button and pull this guy out.
Under the belly button. Ooh!
Nice work. Our scope shows that everything's clean. We've removed the gas, so let's close him up and get him to a fast recovery.
They're stapling him! What is wrong with these people? They're not doctors! They're stapling his stomach!
Our patient is now in recovery, and he'll probably be there for a few hours. We'll send him home when he's able to eat something and drink fluids easily. We'll also make sure he can walk on his own before we let him go.
You're not supposed to staple.
Diarrhea, and his doctor will probably have him on a special diet to follow for a few days. He should be ready to resume normal life after a couple days of taking it easy. And that's how we perform a laparoscopic cholecystectomy. You did a great job today.
No, I
While
didn't.
you're here, try your hand at one of our other surgeries here on surgerysquad.com.
You know what? I already did this. I did this on my own. You know what? I'm going to make you guys sit through another one. It's only going to be about... Pull it up. Thank you. No, not thank you. Okay, thank you. I'm not getting this. Okay, I'm doing this one. Now, I'm gonna go full screen. I'm gonna stop. So, this is gonna be about 25 minute, 30-ish minute video. Who cares? That's not too long. And I haven't done my homework yet. I should do that. Sorry about that. I hit my mic. Oh, dude! One low price, $4,499. Bought it already. Let's go. No, don't click those. Don't. Let's go. Maybe inappropriate for children or squeamish for adults. Yeah. I mean, I'm sweating right now. Wave me. La la. Swat. Don't take that out of context.
Welcome to Surgery Squad's virtual laparoscopic RNY gastric bypass surgery. I'm Dr. Jeff, and I'll be your guide for this procedure. Are you ready? Let's scrub in. Gastric bypass surgery is designed to assist an obese patient in weight control. In this operation, we'll create a very small stomach pouch from the existing stomach. We'll then attach the reduced section of the stomach to the small intestine.
That's weird.
There are several common types of gastric bypass surgeries. We've recommended laparoscopic RNY gastric bypass surgery for our patient. The procedure will usually take 2 hours to perform, but with skills like mine and the magic of the internet, I bet we can whip this stomach into shape in about 5 minutes.
Yay! Short
Our
video.
patient has been prepared for the procedure with a mild sedative, and now the anesthesiologist places a mask over her nose and mouth, and she'll drift off into dreamland. From here, we'll place an endotracheal tube down the patient's throat. You're up. See if you can get the tube into place.
I mean, like, I was refusing to have the shots. Like, I don't know why. Just go. Go. Okay. Can I do this? What am I supposed to do? Put it there, and there. I'm breaking physics. Pop. That's funny. You know what this looks like? Looks like one of those things that shoots water into your mouth.
This tube is then connected to a respirator.
Like a boss!
The patient is ready to go. Now we can begin our laparoscopic procedure. The first thing we'll do is make 6 half-inch incisions in the abdomen.
Don't tell me I have to
Slide the
click all
scalpel
these.
in where I have marked to make the incisions. Be careful. These are small incisions. Don't get carried away.
I think I'd be pretty careful if I was doing this. Which I wouldn't do this, by the way.
Nice technique. You must have an excellent teacher. Oh, wait, that's me.
Yeah!
Next,
You're a horrible
we'll place a
teacher.
device called a trocar into each incision.
Don't make me do this. I like the last one. That didn't make me cut everything open. Okay. Put it in!
These devices allow us to easily slide the instruments into the abdomen. Some of the instruments we'll use include a light and a camera, so we can see what we're doing on a video monitor, as well as the surgical instruments, such as the... Now, to give us plenty of room to work, we fill the abdomen with carbon dioxide. Let's face it, with a newbie helping out, we'll need all the room we can get. Time to start the gastric bypass. We'll use this monitor here to see our work. In RNY gastric bypass, we eliminate up to 90% of the stomach by making the patient's stomach the size of an egg.
That's
we
disgusting.
do this by first placing a line of staples that separate the smaller new stomach from the whole old one. Then we sew along the staple line to make sure there are no leaks. As the patient heals, scar tissue will form to create a permanent separation.
Yeah, my dad was
Click
telling me about
the stapler where
scar tissue.
indicated to create the new stomach pouch.
Pop this down here.
We'll now sew.
I'd actually like to make a shout out to Jacksepticeye.
We'll now separate the small intestine from the old stomach, about 2 feet down.
Let him finish, yeah. Well, I don't want to be rude.
The lower part of the intestine will be connected to the new, smaller stomach, with a half-inch opening between the stomach and the intestine. It's kind of like rerouting traffic on the 405. Use the electrocautery device to create a half-inch opening where indicated in the new stomach pouch.
I'm trying to look at this and see. That's I'm just looking at it really wrong. Okay, guys. So I would like to make a shout out to Jacksepticeye. He was the one that gave me the idea of doing this. That's a hair thing. I don't know. I'm not smart.
Now, drag the loose end of the intestine to the new stomach pouch to attach it.
I'm not smart.
I'll add some sutures to hold it.
I can't do hair. Look at my hair. Look at that. What am I doing?
I'll add some sutures to hold it all in place.
Got it.
Because we need the secretions from the old stomach to assist in digestion, it gets reattached to the small intestine several feet below the new stomach. This part takes some guts. I need you to drag the free end of intestine attached to the old stomach over to the spot on the small intestine where indicated. Again,
What am I doing? I don't think this is good that I don't know what I'm doing. I don't think this guy's going to end up, very happy with his new tummy. It's a woman, isn't it, though? No offense. 26 minutes. It's because my game's lagging, isn't it? Am I supposed to do something? Was I supposed to, put it in there? Oh, no. Okay. Click it. Bring it up, up, up. Bring it up, up. Unveil it. I don't care if that's not how the song goes. Was I supposed to bring it down there?
I'll suture it all into place.
Thank you!
The new smaller stomach pouch was created. Everything has been reattached, and we checked for any leaks in the sutures. This new configuration allows our patient to feel full sooner when eating, but also lets the fluids from their original stomach aid in the digestive process. I'll need you to remove each of the laparoscopic instruments and trocars.
Don't make me do this! Bop, 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 bop. That is disgusting.
Now we need to suture each of the incisions.
Bop, 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 bop. Bop, 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 bop. That was
nice
really...
work. I bet that won't even leave a scar.
Bruce.
Now our patient goes off to recovery. In most cases, they'll spend a few days here in the hospital so we can monitor their progress. Afterward, our patient will meet with her doctor and a nutritional specialist. They will assist her with her new lifestyle and eating habits. You've been a great help. Why not try another fantastic surgery at surgerysquad.com?
No! Okay, guys. None of that was inappropriate. If any of these were inappropriate, I would have cut this whole video, not shown it at all. But they weren't, I don't think, but that's all I'm gonna say. And I guess I'll see you guys in the next video. Bye!